Once more, you're watching Boritzer's Bio Briefings, a weekly show of everything you wanted to know about biology, medicine, and healthcare, not only in Hawaii, but also around the world. And we bring you the latest information, the latest people, everybody's getting talked about, and things you didn't expect. We're not your normal show. We get sometimes a little off the wall. We get excited about what we're talking about. We get enthused about our guests. And today we have a special show. We're actually going to be reviewing the familiar phrase, no man is an island. And that means that just because you live on an island doesn't mean you don't deserve the best in health, medicine, and care. And we're going to be reviewing the healthcare provided by various islands. We are not going to cover Hawaii at this time, since Hawaii is normally our subject of interest and focus. We're going to be looking at some other islands all around the world. We're going to review 6 islands that have something to teach us about how healthcare should be or should not be given or purchased. And we're going to start with a discussion. Actually, we're going to go around the globe. So we're going to start with our closest neighbors right here in the South Pacific, the island of, I think 3,000 islands of Fiji, if I'm not mistaken, or maybe 1,300. I visited Fiji in 1996. I sailed from Hawaii to Fiji. It takes quite a bit of time. It took about 2 months. And had a chance to visit their medical school and their public hospital, and also talk to some of the practitioners. But today I'll give you the facts, as they say on Dragnet. Just the facts, ma'am. Just the facts. Let me give you a little background about healthcare in Fiji. Fiji has actually only one private hospital. It caters to people who can afford high treatment costs. The majority of people depend on the public health system. Actually, these public health facilities are in pretty poor condition, and short of basic medical supplies and staff, they are somewhat wanting. There's a constant migration of physicians and other healthcare personnel to developed countries, primarily to New Zealand and Australia. Actually, Fiji feels very close, being geographically in much closer proximity to Oceania than it is to the mid and northern Pacific. 60% of the people in Fiji live below or at the poverty level. The average person owns in US dollars $60 to $80 a week, and it has to feed actually 4 to 6 people. So you see, it's, the budgets are pretty skimpy. And as I said, it has a lot of islands. Mode of transportation is primarily on the big island of primarily roads, but boating is heavily dependent on for migration between islands and small aircraft. What are some of the problems that there are? Well, one of the big issues is cervical and breast cancer, most prevalent form of cancer in women in Fiji. Most women do not know about such thing that we take for granted right here in Hawaii and the United States, like pap smears. They're also not educated in self-examination of breast. Diabetes, hypertension, the usual culprits abound. Premature death from heart disease are pretty much almost at an epidemic proportion. Most people go through life not as going up for periodical checkups. So if they have any issues, whether it's cardiac, whether it's diabetes, whether it's inflammatory diseases, they go untreated and unmanaged. For instance, that's not even available in the country to get simple procedures that we take for granted, like cardiac catheterization. The incidence of AIDS and HIV is also increasing rapidly because there's very little educational or preventive health services to minimize the risk. In fact, the Minister of Health thinks that there's an actual epidemic or pandemic, if you like. And so I'd like you to see a little film. Not the films we're going to be showing today relating to the 6 islands that I've chosen are specific and focused on several issues. And in some cases, they are perhaps produced by the Health Ministry, which has a perhaps vested interest in showing its positive side. But you'll see the good, the bad, and the ugly. So, Maestro, if you don't mind, let's roll with the Fiji
During the flood last year, the water level inside the quarters was here, but outside it was a bit high up again. Inside it was a bit low, this level. I started here in March 28, 2008. So altogether the population was 2884 when I started here. Last year I did my census, it came up to 3114. They're very sick. When it's late for them to go to the hospital, they end up here. And from here we'll call the ambulance or try and call them through the RT and get the doctor up here or the midwife to come up here and tend to the patients here, because the thing is we have transport problem here. So I'm looking forward to the new quarters, because in these small quarters, like we are all squashed inside, everything is done in one small room. I don't have place to where my patients can sit, can wait. Sometimes I have to cook the lunch for them. I have to put them in, I have to get them, take them to my house. I'm looking forward to the new nursing station because it'll be quite a big clinic, and secondly, I'll be having some privacy from the patients. The Australian government has done a great help there by building that new nursing station.
When I sick, I came here a lot. A lot of us from the village, we came here.
This center is now located at such a place that is not prone to natural disasters as flooding. It's on a higher place now. So during rainy weathers, the facility will still be accessible to them. And we'll not be able to close it as we did it to the old station before. And at the same time, again, this is a new facility. And though we'll have the same staff here, but the provision of services will be more. She'll be able to deliver better and more services from this new building. This is a complete separate unit. What we used to have before is the clinic and the residence of the nurse was in the same building. So what we can see here is that this is a separate clinic which has got a bigger space, which has got a bigger waiting room, and it has got all the facilities that are needed within the building. So patients will not have to go out to use the washroom. It's all inside here with a large waiting space as well. This assistance is really vital and in time to cater for the needs of these people here. Thanks to the Australian government for funding this project for us.
We are back, and I hope that you're enjoying our around the world tour of healthcare services in island nations. That was one of the first significant country that I visited when sailing around the world. And the next one I came to was actually Tonga. Now, I didn't take any movies at the time. Actually, I didn't take very many pictures at all. And I came to an island that is called New Tapu Putapu. New Tapu Putapu is an island at the northern edge of the Tonga archipelago of islands. There are actually various groups of islands, but this is the northernmost, the closest to Western Samoa. And I stayed there for about 2 weeks, and the local people were very, very friendly. They usually have very little contact with the outside world. The New Tapu Putapians survive mainly by fishing and collecting crabs and raising vegetables on a very small island, 1,000 people, as I said. They have a small airfield and no port facilities to receive cargo. When they receive cargo once every 6 weeks from a New Zealand Navy ship or supply ship, they actually have to go and paddle out to an anchorage to collect whatever they want to collect. They get, as I said, mail once a week. There is no telephone, or there was no telephone service. I imagine that by now they have satellite telephone service to connect with New Zealand primarily, but previously they used ham radio or shortwave radio for communications. And what they decided that they wanted to show me the pride of their healthcare services, and they had a small clinic, actually, or I guess you'd call it a clinic. It was a 4-room building made of concrete with openings for windows, but obviously without windows because it wasn't really necessary, and that the climate is very, very friendly. very little variation in terms of weather. And they had the bare necessity, but apparently it was enough for emergencies. There were a couple of cabinets in the corner, and it was very strange because when I walked through the rooms, they showed me an examination table and so on, but when I looked down, the floor was not actually padded. It had I believe it was hardened earth on the floor. There were no doors as such, and the people could just go in and out. There was no permanent residency in that facility. It was basically a holding facility until they could get medical support if there was something really serious. Then the New Zealand Air Force would send a small plane because their airstrip was fairly limited in what it could accommodate. So it was interesting, and it showed me, especially coming previously about 5 or 6 months before that, I had left Oahu, and it showed me that you don't need much to survive with the basics. And I think there's a certain advantage, or perhaps a disadvantage, of having a 1,000 person population base, that either everybody is going to catch whatever someone is carrying, or no one is going to catch it, and they're fairly well protected from outside disease influences. People very rarely travel off the island. I think there are 4 civil servants. There's a postmaster, there is a nurse, and there are 2 teachers. And everybody else stays on the island all the time, doing their thing. Very lovely people, very accommodating, very hospitable, and really very interesting. So from there, I traveled on to the next place, then one of the newest countries in the world, one of the newest members of the United Nations. Can anybody guess what that is? Timor-Leste. Can I see by a show of hands? Anybody know where that is? Well, Timor-Leste is on the tip of Timor Island, which is on the northeastern portion of Indonesia. Well, it was actually part of Indonesia until they opted to overthrow the Indonesian regime. I believe it was over 15, 20 years ago. And if anybody knows the history of Timor, Timor was a Portuguese colony, just as all of Indonesia was a colony of the Netherlands for over 300 years. So a lot of indigenous peoples were conquered during the voyages of the explorers from the European subcontinent in the 14th, 15th, 16th century. And the Timorese, the northern part, actually the island is divided. The northern part, which they call Timor-Leste, is the Portuguese-speaking and Catholic population. The rest of the island is Muslim. And today they're actually the country of Timor-Leste inhabits the northern parts. The rest of the Timor is part of the Republic of Indonesia. There's still, as you can imagine, some stress and tension. Basically, Timor-Leste has some good things going for it, in spite of some of the difficulty of their political birth, handicap because there isn't a lot of population basis or trading people who will speak Portuguese. So the government is also limited in the number of English speakers. But I think that's changing day by day as we speak. They are a model for a country that needs help. They're lacking basically in everything. They have perhaps listed 65 community health centers. They have an ambulance central system. Put the basic on the district level, 4-wheel drive vehicles. When they get a really serious case, they call in Australia. Australia, again, just like New Zealand in Tonga, Australia is kind of a protector of many of the South Pacific islands, it being their former colonial, so to speak, boss, or perhaps serving as a vehicle for the previous French or British governing community and expatriates and so on. And the Australians helped Timor after they received independence, or fought for independence to be more accurate. they helped the Timorese discover oil. So Timor has a natural resources. It has very little wealth or very little investment capital to go and develop it, so they've sold part of their resources to the Australian who came in as investment capital purveyors and helped them develop this particular industry. But as with all natural resource extraction, this will take many years, and consequently, even wealth does not always buy the level of sophistication or development that you need to get a new country on course, whether it's education, healthcare, commerce, industry, and so on. So education is the next level of things that they're trying to do. They have only 50 Timorese who are actually medical technicians. Very few physicians. Most of the physicians and medical personnel are Australian. Let's look at a film that I want to show you about the state of events in the healthcare system of Timor-Leste.
A portrait of colour after wet season rains. This is East Timor, one of Australia's closest neighbours and one of the world's poorest countries. Half of the people here live on less than $1 a day, many of them as subsistence farmers. This year Australia is spending $117 million in bilateral aid, more than any other single country.
It's very important to us that our neighbours are our friends, and that we together develop the stability and the prosperity that this country really should experience.
One of Australia's top priorities is improving the health of East Timor's people. This is a country where women regularly die giving birth, and where almost half of the children between 0 and 5 are officially underweight.
Okay, let's wait for the beep, beep, beep. Okay.
In this clinic in the capital, Dili, Australian midwife educator Florence West assesses one of her students.
Wait until you feel it. If you can't feel it, then we need to move closer to the heart. No, okay.
AusAid has invested around $230,000 in this program to upgrade the skills of midwives in East Timor,
So our heart's on the left,
part of a focus on improving the health of mothers and their children.
So just pop it here, you should be able to hear it, but you'll get a lot of breath sounds first. Okay.
On average, each woman here has around 7 babies, one of the highest birth rates in the world.
It's going like this.
This course covers a broad range of subjects, from developmental checks and family planning, right through to managing a high-risk labour. It's hoped programs like this will reduce maternal mortality here, which is currently 100 times higher than in Australia.
One of the biggest killers of women in East Timor and in any developing country is not having a skilled attendant at delivery, meaning a person skilled in obstetric emergencies and managing neonatal resuscitation. So before the Diploma 3 program was introduced, the midwives would not have the skills to identify a high-risk labour and to manage an obstetric emergency.
Hai Tia Lisa, bon dia. Dia ke lai? Dia? Sente dia ke tuan? Okay, how dokter ready? Eman nebe mak responsável ba ite bot ni operação, nebe halu ite bot la senti moras. Okay?
Dr. Eddie Brandown is a man making history. He'll soon qualify as East Timor's first anaesthetist. His role is so important, his colleagues joke he needs bodyguards. Here in the National Hospital, he and his surgeon colleague Dr. João Ximenez are doing their final checks before today's operation. Augusta is 59 and has been badly burned by boiling water. She's lost all 10 toes. Both her doctors have been trained through the Royal Australasian College of Surgeons, a project funded by AusAid.
They are the first generation of Timorese specialists, and they will be leading the development of the various specialties in this country. In a few years' time there will be many more, but they will be the first generation and leading that development.
As well as helping Eddie become qualified, Australia has also funded the training of 6 other Timorese doctors in surgery. At independence a decade ago, there was only 1 surgeon in the entire country.
Well done.
Now, a range of operations can be performed routinely and safely. Today, it's a skin graft, the first step in healing Augusta's badly burned feet.
We have fortunately a very good Timorese surgeon who's been trained by our program, and he does the skin grafts. He's really the burn surgeon in this country. Dr. Zhao over there. The anaesthetic is given by Dr. Eddie, who will in about 2 years' time be the first ever Timorese anaesthetist.
Qualifying as an anaesthetist takes a long time, so in the meantime, Dr. Eric has also trained 21 nurses in basic anaesthesia. It's here in the districts where 95% of the population lives that the benefit of the training is being felt the most. Now, for the first time since independence, operations like caesarean sections can be carried out. In Maliana, 3 hours drive from the capital Dili, AusAid has funded the training of 3 nurse anaesthetists. Romaldo da Cunha is one of them. Every hospital in East Timor now has someone like him.
For training tianene, ya perkembangan kita ke luar biasa. Tambah durante nene ami ansa desde Indonesian tempo to be ansa sadene ansa anestesia au ansa operação ne yene la ya.
28 solo para abajo solo.
Amelia Boritzer is one of a kind. In the same regional hospital, she's the first woman ever to practice dentistry. And in a couple of months, she'll be the only dentist in the entire district. Amelia is one of more than 80 Timorese health professionals who's had funding to train at universities in Australia and in the Pacific.
The scholarship program is a very important part of our assistance because it really does focus on those people who are going to lead the country in the future, in whatever way it is, as people who will help to build a curriculum, as people who will have particular skills in health. For instance, we trained the first ophthalmologist for East Timor.
For more than a decade, Australia has supported the health sector in East Timor. In that time, there's been a 10-fold increase in access to services. The long-term investment here continues.
Okay, so we got to Dili, which is the capital of Timor-Leste. And we decided that we wanted to see how Timor-Leste could look in 20 years of investing in their medical infrastructure and in their people and in their training, etc. And so, what would be the next best place to go? How about seeing the top world-class medical health and healthcare services? So you say, where is that? America? No, I'm sorry to say America is not at the top of the list. Actually, it's in the industrial or OECD countries, it's pretty down. For the amount of money we spend on healthcare, I think we are the highest in the world, and we probably get the least value for our money. So if you want to see a place that really extracts the best for a fair amount, we'll get on a bus. We'll take the bus or the taxi to Dili Airport, get on a plane. 2 hours later, we'll be in Darwin. Darwin is on the northeast coast of Australia. Actually, Darwin has a large population of Aborigine people, a lot of people who also come from across the big channel from Papua New Guinea. And so we get to Darwin, and we're going to have to take a plane to Singapore. Yes, Singapore, ladies and gentlemen. Top flight. Singapore has probably the most efficient widespread system of healthcare, ranked number 6 in the World Health Organization's ranking of the top health systems. Bloomberg, you know Bloomberg News? Mayor Bloomberg was the mayor of New York City. Well, his organization that gave him, that he had built up in terms of commercial and financial data, ranked the Singapore healthcare system as the most efficient in the world. In fact, competing very closely with Hong Kong. And efficient is what the name is all of this game is all about. So Singapore has a system, a public healthcare system, which is largely based on compulsory savings, subsidies, and price control, all within a national health insurance plan known as MediSave. Each citizen accumulates money that the government tracks, and such funds can be pooled across the family. So if you have 4 family members working, they're contributing to MediSave. Suppose you have a medical occurrence or medical emergency, you can use that fund, not only the one that you put in under your number, your citizen ID number, but your whole family can contribute. So these schemes can actually collect, because not everybody in the same family in terms of probability gets sick at the same time. And you use it up that as you need it for specific medical and health services. Now, one of the really important things about this scheme, in the National Health Scheme, is that no medical service in Singapore is provided free of charge, regardless of the level of subsidy, even within the public health system. So you say, why would they do that? You're putting in money all the time. Well, it's intended to reduce the overutilization of healthcare services. Often we see that when you have a fully subsidized universal health insurance system. Very, very smart. So there's always a cost. Obviously, it's based on the amount of income or the amount of money that you have in your MediSave account. But no one suffers because they don't have a full backing in their MediSave account. Now, the highest level of subsidy is typically small, and even for those people who can't afford it, they are subsidized to a high degree. Approximately 70 to 80% of Singaporeans' healthcare, even if they can afford to go privately, they still obtain their medical care within the public health system. It's such a terrific system. The quality is just unbelievable. I've been there. I've used it. Actually, I was a patient. If you remember one of my previous discussion and shows on hospitals around the world talked about St. Elizabeth Hospital. And I was very pleased with the level of care that I received there. Singapore currently has the lowest infant mortality rate in the world. In terms of both efficiency and financing, the outcomes are stupendous, just unbelievable. So the problem is, though, that as good as the Singapore hospital system is and the healthcare system, it's very difficult to replicate such a system anywhere else. And that's because Singapore is still a country of 3.5 million people, geographically very condensed, about the size, I would say, of maybe Long Island or maybe some other metropolitan area like New York City. That's the size of the whole country. So it's still manageable, but the structure and the financing is just unbelievable. So we're going to be seeing a movie. Maestro, are we going to see the movie before the break? Okay, so just to let you know, in case you turn down to our channel and you don't know where you are, you're a little confused, you're seeing visions of Hawaii, visions of Singapore, Timor-Leste, Fiji. Well, you're watching Boritzer's Bio Briefings right here on Think Tech Hawaii. We're talking about islands of health across the globe. Stay tuned, don't go away. I'm watching you.
Hello, I'm Martin Despang, and I'm the host together with the one and only Ali Yamashita, and our show is called Urban Transcendence. And Urban Transcendence is about identifying where we have a unique situation of a vibrant city in one of the most beautiful natural environments. So how these two can coincide, sometimes conflict, how they could find reciprocity in the 21st century is what we're excited about. And we're planning on bringing in a diverse body of guests, both from the arts and the science and the established and the wise and the emerging generation. So hope you will join us. We'll always be on Thursdays from 1 to 2 p.m. Thank you.
You're back. You're watching Dr. Rafi here in Boritzer's Bio Briefings. We are talking about islands of health around the globe. We discussed prior to the break the situation of probably the world's best healthcare services provider, the government of Singapore. And why don't we see what they do in actuality? Why don't you let it roll, Maestro?
Low infant mortality rate, long life expectancy, high quality and standards, safe and trusted, accessible and affordable. This is Singapore's healthcare system. In a climate of constant and rapid changes, Singapore's healthcare strategies are focused on ensuring access to good and affordable healthcare, promoting good health and reducing illness, pursuing medical excellence. Our healthcare challenges have evolved over the years. An aging population, new and complex conditions, greater demands on healthcare manpower. To meet the challenges ahead, we need to adapt and innovate, keep health policies and programs relevant. Singapore has a multiple-layer protection system based on individual responsibility and co-payment. Every Singaporean can access good healthcare. Heavy government subsidies at subsidized clinics and wards. We also have the 3 M's. MediSave, a compulsory health savings account to help patients pay for the co-payment. MediShield, a voluntary and low-cost health insurance system to pay for the large bills. MediFund, an endowment fund to serve as a safety net for those who still need help. Together, the 3 M's ensure universal medical coverage for all Singaporeans. A comprehensive and integrated system of public and private healthcare facilities across acute, intermediate and primary care sectors to serve the needs of the population. A public hospital is supported by a variety of primary, intermediate and long-term care services in the region. Patients in need of continuing care after discharge from acute hospitals have wide choices to suit their needs, from community hospitals, nursing homes, daycare to home-based services. Singaporeans can receive subsidized primary healthcare at polyclinics situated all over the island. The result? An integrated system in support of Singapore's vision of one family physician for every Singaporean. Our national health promotion efforts focus on preventing illness by helping all to keep a healthy lifestyle. We want to have a healthy workforce and the healthiest young population in the world. To improve healthcare, we invest in biomedical research. Our specialty centers are making great strides in translational and clinical research, supporting clinical trials, and working with various international partners. The Biopolis is a purpose-built biomedical research hub. It has attracted top talents all over the world to spur medical discoveries. A responsive and effective regulatory system helps Singapore secure a global reputation for safety and quality. We harness information technology to enhance medical excellence in care delivery. Our goal is one Singaporean, one health record, as we build a national system to share medical records. A world-class healthcare system is founded on the quality of its medical education. Singapore's first medical school, the Yong Lu Lin School of Medicine, has been steadfast in providing well-trained doctors with its world-renowned teaching. The new Duke NUS Graduate Medical School allows graduates passionate about medicine to become physician scientists. It's a never-ending journey, caring for the health of a nation. We must challenge ourselves to meet the growing needs and expectations of our people. Our priority remains to have a healthy Singapore, where all Singaporeans can have access to high-quality and affordable health care.
If you forgot where you are, you're watching Boritzer's Bio Briefings right here on Think Tech Hawaii Television. We are talking about islands of health around the world. We just saw a movie about Singapore's healthcare system, and if you're thinking about raising a family, you might want to consider resettling in Singapore. It has the world's lowest infant mortality rate and the longest longevity at birth. So give it a jiggle if you can get a residence visa to live in Singapore. From there, we get on our plane, we get on South African Airways at Singapore and move on and go to Madagascar, the place you always wanted to visit, just didn't know where it was. In Madagascar, basically, we are talking about a fourth largest island in the world. So let's see, there's Australia. What else? I don't know. What is that? What are the other two? Oh, well, I'm sure it's not Manhattan in New York City. In any case, it's one of the world's poorest countries. 80% of the population lives in rural area with difficult access to most services. Health services are extremely limited, leading to a high rate of infant mortality and maternal mortality as well. 65% of the population does not have access to safe drinking water or sanitation throughout the island. Can you imagine what risk you are at birth after we just talked about Singapore? There's now a 5-year healthcare program that provides basic quality healthcare to isolated population. They're basically in the north and northwest of Madagascar. They are focused on improving access to and use of integrated packages for maternal, newborn, child health services. They're looking at saving the new population that's coming into the society. They're trying to put all their efforts in the survival rate of newborns and their mothers. So also concomitant with this effort is emergency transport services, improved sanitation. These are all things that are in play as we speak. One of their projects is to decrease morbidity and mortality from treatable diseases such as malaria, diarrhea, respiratory infections, especially among women and children. These are not problems that only Madagascar is experiencing. In many islands in Indonesia's 1,300 islands, we have the same type of issues. But here it's even more dire because there's very little support from any neighbors off the coast of Africa. So Maiso, why don't we give Madagascar a look?
Madagascar, the world's 4th largest island, is an enchanted paradise. Full of amazing landscapes, the island's unique flora and fauna is found nowhere else on Earth. But for the nearly 12 million Malagasy who live on less than $1 a day, this island is no paradise. Like most of sub-Saharan Africa, Madagascar has a serious malaria problem. It is complicated by Madagascar's limited infrastructure. Almost 77% of the population live in rural areas, which are remote and difficult to reach by road. With scattered local health facilities, many Malagasy must walk several hours to reach medical help. Today, we are in the village of Ankaroka in southern Madagascar. We are meeting with Josette, a 34-year-old volunteer with 2 children. Josette is getting ready to do her regular door-to-door visits to some of the 300 households in her village. She is packing the products she will try to sell today. With each sale, Josette will keep a small percentage for herself. This profit acts as an incentive to ensure she regularly visits every household in her village. She will use the rest of the money from the sale to buy more stock at a special discounted rate. For the past 5 years, after receiving a free starter sales pack worth $20, Josette has been selling essential health products such as long-lasting insecticide-treated mosquito nets, malaria drugs, contraceptives, and bottles of home water purification solution at highly subsidized prices. She has also been trained to deliver key health messages to the people in her village and provided with simple educational materials which she uses to inform the villagers about malaria and other important health matters. Like the other 1,500 volunteers working with local NGO partner MCDI, Josette was selected for this work by her village chief and the local hospital.
On donne donc un critère de sélection, un critère de tri au chef focal, au chef de village et au chef de l'hôpital. Et c'est à eux donc de recruter donc les animateurs villageoises. Bon, les critères de tri ou de sélection, donc premièrement c'est le niveau de scolarisation. Il faut donc qu'au minimum donc les animateurs aient un diplôme de CEPE et qui savent lire et écrire et compter.
Since Josette started to sell these products, she has noticed a real improvement in people's health, with the rate of malaria decreasing in her village. Over the last year, she has sold more than 20 nets, making her a personal profit of $12. By delivering door-to-door basic healthcare, Josette is making sure that the link between good health and rural populations remains unbroken. The goal of the Ministry of Health and Population Services International, PSI, an American NGO, is to have 2 community health agents, like Josette, in every village throughout the country. A further 10,000 volunteers are still required to meet this goal. The community-based approach to health product distribution in Madagascar demonstrates how a country can increase health impact in rural areas and simultaneously economically empower people. With a coherent strategy defined by the government in collaboration with its partners, strong donor support and innovative people, this model and its successes could certainly be replicated elsewhere.
You're watching Boritzer's Bio Briefings right here at Think Tech Hawaii Television. We're talking about islands of health around the world. We've just taken a trip all the way from Madagascar, and we are taking a plane going over to Sicily at the tip of the Italian boot. And one of the things you may have seen from the videos that we have viewed today, the fact that economy, geography, education, finances and so on, all has to do with the quality of care that a person has a right to expect in the country that they live. Sicily is no different, even though it's in one of the leading countries of the European Union. It has its share of governing and political problems, not to mention its everlasting Prime Minister Berlusconi. Money disappears, and in Sicily especially, there's a high level or presence of corruption. There's been endemic for years, and perhaps it's affected the fact that the money for building infrastructure and healthcare has been missing. Why don't you take a look at this, what happened to the money?
Sicily, Palermo, land of sun, sea, great food and the mafia. Not anymore the mafia of bombs and daily fear, but serious entrepreneurs investing in, for example, construction companies and healthcare. The mafia sees healthcare as a growth market and invests in private hospitals. The clinics are like public hospitals, completely financed by the regional government. And so Sicily has 1,800 private hospitals, more than in all the rest of Italy together. For the more expensive private clinics to compete, the public hospitals have to malfunction. Looking around in the public hospital Villa Sofia in Palermo, this seems to be the case. Mafia contact within the regional government will do the rest.
Ma la mafia siciliana da anni si è rivolta alla sanità come un settore da infiltrare e controllare per due ragioni principali. Una ragione perché è un luogo, la sanità è un settore economico dove confluisce molto denaro pubblico e la mafia cerca naturalmente di raccogliere denaro pubblico, di sfruttare il denaro pubblico magari spesso grazie ai rapporti con pezzi della politica collusi con la mafia. La seconda ragione è che il settore della sanità è un settore vitale perché ha a che fare con un bene primario dei cittadini che è il bene salute e allora chi controlla la sanità controlla in qualche modo la salute dei cittadini e chi controlla la salute controlla quei cittadini.
Che ci sono costruzioni iniziate 25-30 anni fa, addirittura anche di più, che non sono mai state completate. Questo significa un fiume di denaro sprecato perché poi spesso questi luoghi non sono più adeguati, non sono più a norma, bisogna riaggiornarli. Materiale acquistato che non è più sufficientemente moderno e quindi va a perdere e per giunta non sono pronti per l'utenza.
With a small camera we could take a look in another part of Villa Sofia. In existence for 30 years it has been officially opened 3 times but is only partly working. This block for example is not and hospital people claim there are many like this. So healthcare costs the regional government €8 billion a year, which is half of their total budget. Last month, local taxes were raised to pay for the growing healthcare cost, and Sicilian healthcare is the most expensive one in Italy. In another building, we found the physiotherapy department. 2 nurses let us in via the emergency exit to show rooms where they should treat their patients. The company who provided the equipment brought everything months ago already. But the hospital management does not bring in enough staff. So now private physiotherapy clinics in other parts of the city take care of the patients. Union leader Antonio Fresina works in the hospital. He says the regional government destroys public health care by subsidizing private clinics where owners are obscure and quality is low.
Ma i proprietari sono molto spesso non sono identificabili perché sono magari coloro i quali governano anche la stessa sanità pubblica e quindi non c'è il padrone così della struttura privata, ma ci sono società che poi con un'attenta indagine, se ci fosse un'attenta indagine, si potrebbero scoprire che gli stessi interessi a non far funzionare, gli stessi interessi che hanno quegli uomini che governano la sanità, che dovrebbero far funzionare, ma guarda caso non fanno funzionare, fanno magari funzionare in concorrenza sleale il settore privato. In Sicilia si dice che il miglior ospedale per adesso è l'Alitalia, sempre che l'Alitalia ancora funzioni, per andare sempre in ospedale del nord.
You're watching Boritzer's Bio Briefings. I'm Dr. Rafi Boritzer. Yours truly, we've been doing islands of health around the world, the best and the worst. We wanted to include Cuba, but we decided to do a special show just on Cuba's healthcare. Until next time, until we see you again, remember I'm watching you. Be here or be not.